Recognizing the member from Cariboo North.
Thank you very much, Madam Speaker. I rise in the House today worried and frustrated, like many other British Columbians, to see the healthcare crisis continuing to rage on in this province. Overworked, stressed, and burnt out are the words we hear far too often from our healthcare workers who are tirelessly fighting for the well-being of all of us. While some action is being taken to bring international doctors to British Columbia, the plan is short on details. How many doctors are we expecting? Where in the province will these doctors be practicing? What are the metrics in place to ensure that we will see an increased standard of care and lower wait times for patients? We need a well-rounded, thought-out plan to effectively address the healthcare crisis promptly. Today's labour market outlook shows that there will be more than 1 million job openings in the next decade, but only 38% of these will be filled by immigration. Of these openings, we see 81,500 jobs where there is no plan in place on how they will be filled throughout the next decade. Immigration alone will not fill all of them. Retention of current staff must be a priority, both for the sake of our future healthcare system and because of the moral responsibility we must uphold for the mental well-being of workers. Northern Health has a vacancy rate of 20% for their baseline positions, with 55% of new hires leaving within the first 3 years. This is a prime example of how it's not just important to recruit healthcare workers, we must ensure that we can keep them working here in British Columbia. To strengthen our crumbling healthcare system, BC needs to hire 123,000 more healthcare professionals over the next decade. Interior Health has a vacancy rate of 13.7%, which is an 8% increase since 2019. Our standard of care is rapidly worsening, yet we see no measures in place to ensure improvements. At the heart of the crisis, we see rural communities like my own in Quesnel, struggling for years and left to deal with staffing shortages with little support. We see the struggles across this province in communities like Merritt, Clearwater, Chatwin, Port Hardy, and Port McNeill, among others. In small communities like these, one medical worker calling in sick can literally shut down the only clinic in the community, forcing patients to drive hours for basic medical care. For example, in 2022, Mackenzie Hospital lost more than 300 hours of service due to closures. On the North Island, from July 2022 to 2023, the Port Hardy ER was closed 1,274 hours, 25% of the time due to staffing shortages. The Mayor ER has already closed 7 times since the beginning of the new year. And in Elkford, the temporary ER closures have lasted more than 17 months. The list goes on and on. BC's rural communities need more than vague promises of more doctors. They need specific details on how many doctors are going to be brought into these regions and how these wait times and closures are going to be alleviated. The fact of the matter is that introduction of internationally trained doctors alone will not solve the staffing shortages across the province. However, other measures can be taken immediately that would complement this action, including the introduction of physician assistants into our medical system and the development of the long-anticipated Simon Fraser University Medical School. Our healthcare system is crumbling. People's health, lives, and well-being are at risk. The time for action is now. British Columbians are suffering, healthcare workers are suffering, and it is our job to ensure their needs are met for the safety of everyone in this province.